Welcome to Facebook Live. I'm Joanne Conroy, CEO and President of Dartmouth-Hitchcock and Dartmouth-Hitchcock Health, and I'm joined here today with Dr. Sue Mooney, who is President and CEO of Alice Peck Day Memorial Hospital in Lebanon. So thank you, Sue, for making the time to talk about Alice Peck Day, talk about yourself, and really acquaint the community with the things that you do at Alice Peck Day.
Well, thanks for having me. It's a pleasure to come over in the midst of all the changes that are occurring in our world based on COVID happening. But I appreciate the opportunity and really appreciate the chance to introduce people to APD because it's a pretty unique place.
Yeah. We'll talk a little bit about APD. As we were chatting before we went live, there are people that know and love APD. They've received their care there for years. But not everybody knows about APD. And so talk a little bit about the origins and the things that make APD really unique in the community.
Yeah, APD was named for Alice Peck Day, who owned the land on which the hospital is built. And in 1929, when she passed away, she left her homestead to the town of Lebanon, and she gave them 3 years to create a cottage hospital. And remember what was happening in 1929. It was the heart of the Great Depression. So it was not an easy thing for a town to come together to create a hospital. But they did it. And in 1932, the hospital opened in the original homestead building, which was Alice's home. We're all pretty convinced that she's still there. There's ghosts at APD if you want to come down to our place.
Really? How do you find them?
Well, she finds you.
Okay. So
there's lots of stories about going and being in the homestead, and not many people are brave enough to stay there late at night. You know, we started as a hospital, believe it or not. A cottage hospital was an obstetric hospital for safe delivery of babies. So for many, many years, APD was the place where the town of Lebanon and surrounding towns, that's where they came and they had their babies. So it started as a hospital that was really about the community. It was supported by the community and always has been. Of course, over the years, it's grown and changed, as we all have. And today, it's got a depth and breadth of services that we're very, very proud of. But I think the hallmark of it is that it's really been committed to improving the health and the well-being of the community since its inception. And it's really stayed true to some core values that really are around community and service to the community, kindness to each other, and a real sense of partnership with the community and with others. We really talk about community being us as much as it's out there. So we talk a lot about our workforce and our people and how that's what really makes APD so special.
Yeah, you know, I think that people don't always appreciate that our facilities, and Dartmouth-Hitchcock Health, we're all part of, we employ so many people in the communities that we live in and work in. That we are the community. And as we talk about having all of our employees be ambassadors to educate the community about the safety of our facilities, they're our best ambassadors, really. So talk a little bit about your career, because you came to Alice Peck Day as a practicing obstetrician and gynecologist.
Yeah, I did. So I trained in New Mexico, so very, very different environment than here.
Pretty rural, though.
Very rural. You know, University of New Mexico is the only tertiary care center in the entire state, and it's a huge state. But it was a bit of a shift for me. I've always loved New England, really wanted to be in this part of the world. And when I first came, I actually worked for Hitchcock Clinic down in Nashua, but felt as though this part of the state was a better fit for me, and a small community hospital was a better fit. So I worked at APD as a full-time OBGYN for the first 5 years of my career. And at that time, we were very busy with obstetrics, so we did a lot of deliveries and a whole lot of GYN as well. I got really interested in improving healthcare quality, and I think that's been sort of the driving force of my career for the last decade or more. And as I got more interested in quality, I got more interested in leadership. Went through a CMO job and then into the role that I've been in for quite some time now as the CEO.
Yeah.
So it's been a journey, but I think the real path has been about how do I make healthcare better. Very, very passionate about improving what we do every day.
Yeah. Now, what year did you become CEO at Alice Peck Day?
So it was 2012. So Alice Peck Day, one thing to remember about us is that we were a health system that included the hospital, but we also have senior housing. So our life care business includes two residential facilities, one of which is assisted living and supported care. The other is independent housing. So in 2012, I became the CEO of the hospital, and in 2013 became the CEO of the health system, which meant I was responsible for the senior living as well.
Which is significant in size. I know some people that have, I don't know if it's the rail trail that goes really close to
Yes.
it, but they kind of went on that portion of the rail trail and said, wow, who owns this gigantic facility back here? How many apartments are in the senior living, independent living?
Yeah, so at Harvest Hill, we have 70 apartments plus a 7-bed memory care unit. And at the Woodlands, which is the independent housing, we have 62 units. The facilities are, they're senior housing. So Harvest Hill, the average age is about 88 years old. And Woodlands not too far behind, probably about 85. Some couples, but clearly predominant female mix in both facilities. But that's been a real challenge in the course of this COVID epidemic. I think everybody's familiar with what we've done for hospitals, and I think we've all done very similar things. But we had to think through how to navigate COVID in elder housing, which was really challenging, and we're really proud of the work that we've done there so far. Everything is going quite well for us.
Yeah, I would say the Upper Valley has been spared, at least as far as we know for now, the really challenges that they face in the southern part of the state, where they've had significant infection rates in some of the nursing homes. Talk a little bit about the things that you put in place, because you guys were really thoughtful about how to protect both the residents, the staff, and that probably was associated with a lot of tough decisions about visitors, et cetera.
Yeah, you're right on. I think we were very early and very aggressive about trying to wall off the facilities from the outside world. And so one thing that you have to remember is that the folks that live in these facilities are autonomous folks. They can come and go as they want. So have to use a lot of influence and education and conversation to sort of get folks to choose to stay in. And so we facilitated that by helping to shop for groceries and to pick up things at the store and run errands for people to make it easy for them to stay home.
Yeah.
We also really looked at, re-engineering meals, because we do provide meals to residents. At the Woodlands, they only get 2 meals a day, but we went to 3 meals a day that we deliver to their homes now. Harvest Hill, we carry meals back and forth and the dining rooms are shut down. We also have a lot of caregivers that come in, so from like the VNA or the VNH, from other private places. And we really needed to work with them to make sure that they followed the infection prevention processes that we use.
Right.
It was really easy with our colleague Johanna Bellevue over at VNA because we knew what she was doing,
Yeah.
but with some of these other folks we really had to reach out and work a lot harder. I think the biggest challenge was the families. You know, families want to see their loved ones,
Yeah.
and to tell them no, you can't come, has been really hard.
Yeah.
The other thing we are wrestling with is, you know, for elders, deconditioning and social isolation. Those are things that aren't good for their health either. So it's a real balancing act, but I think we've got a really good path forward. And obviously the staff up there is phenomenal.
Yeah.
They are so committed to those residents, and you know, we don't have to tell them to screen and to wash their hands, and they do it because they love their jobs and they love the residents, and they are really the stars of the show.
Yeah. I know when we were distributing face shields,
Yeah.
you said, hey, we need face shields too. And it's something that actually wasn't on our radar screen, but we realized, yeah, you absolutely do need them to really protect the residents and actually protect the staff as well.
Right, right.
What are some of the, because you've got a lot of really smart people that are aging at the Woodlands and Harvest Hill, I'm sure they've got some cabin fever. So have they come up with some interesting ways to socialize? You know, I think it's a myth that older people can't use technology. You know,
Right.
they figure out how to use
Yes,
it.
they do.
So what have you seen?
Well, you know, it is amazing that the sophistication in that community is really impressive, and they're very creative people. So you know, the Woodlands has their whole Woodlands Athletic Association, which is all like Wii games, and so they play all sorts of stuff. And then, you know, they've figured out how to do activities with social distancing. They play games like Sequence and Bridge, and, you know, so they just are creative and they figure it out. So they do the same things that you hear about with social distancing, you know, cocktail parties.
Yeah.
They do the same thing we do.
A Zoom cocktail party at the
Right,
Woodlands or
right,
Harvest Hill.
Right, and you know, now that the
That could be a
weather's
TV
better,
show.
it could be. Right? Now that the weather's better, they can get outside,
Oh, yeah.
which everybody loves to get outside. It just feels so refreshing to be able to go get some fresh air and go for a walk.
Yeah, yeah. I'm sure that they will be relieved when some of the limitations are lifted, but there's also a lot of caution.
Yeah.
Because it is a community that's vulnerable.
Yeah.
And we know just from looking at other nursing homes and senior facilities. Have they asked you about testing?
Oh, yeah, it's such a great question and very, very timely because there is a move to test universally, and we're working with the state right now to have all of our staff at the Life Care tested and as many residents as are wanting to be tested.
Okay.
So the state's actually coming on the 27th
Okay.
of May to do that testing for us.
Yep.
And then the real question is, how do you test moving forward? Do you keep testing? Do you, you know, do you just do it once? Do you do it then based on symptoms? So we've still got a lot to work out. And, you know, another plug for being part of a system, we've relied really heavily on infectious disease specialists at the state, but also here. And I can't tell you how grateful we are to the expertise and the docs that you have here who have been so generous with their time and their knowledge. It's really helped us tremendously.
Yeah, it'll be fascinating when somebody looks at the results of the test. I don't know who will actually get the results. It's a good question. But, you know, if you end up having somebody that is positive, you know, how are you going to address it? My expectation is we probably won't.
Right.
I think in asymptomatic communities, when they've tested 1,000 people, they have randomly found maybe 2 people that were positive in 1,000.
Yeah.
And that's in areas of the country that are like New Hampshire, really have a low endemic rate.
Right, right.
I think it'll be interesting. We are developing antibody tests, and whether or not that actually has some utility in the future as you kind of continue to assess the health of large communities of senior citizens, trying to determine what's the level of herd immunity in that group.
Right.
So.
And, you know, interestingly, I go back to my quality training, and so, you know, sort of pushing people to do sort of failure mode effects analyses, do a FEMA, like, okay, so what happens when it is positive, or how could this go south on us? And so doing that thinking ahead of time is just something we're continuously doing at APD. It's like, how could this go off the rails? And what will we do to mitigate the harm and the risk, which is what this is all about. We know we can't eliminate risk, so it's all about mitigating it and then containing if there's a problem.
Yeah. Well, knock on wood that it'll be a kind of a nobody is positive on the state testing.
Right.
But anyway, we'll deal with it if it's not.
Exactly.
Now, talk a little bit about your strategic plan. I know that Alice Peck Day and your board and your communities spend a lot of time actually developing a strategic plan. What aspect of that plan do you really love, number one? And number two, do you think you have to adjust your strategic plan given the pandemic and the limitations that the pandemic has put on how we deliver care?
I think it's a great question. And so, you know, the parts of the strategic plan that I really love are the fact that the board really reaffirmed our commitment to our community, which is our sort of core. And so reaffirming that and simultaneously acknowledging that we're part of a system and that we have a role to play in that system, and that a big piece of that role is supporting the academic medical center, because we're only 4 miles away, right? So committing to the community and being an important partner to the academic medical center, I think, is sort of the essence of the plan. And as we've looked at that, we sort of said, you know, the epidemic and COVID may change the timing and the emphasis and the sequencing of what we do, but it's not really causing us to say, oh my gosh, we had the strategy wrong. If anything, I think what we're seeing, and I know you're seeing, is that because of the things that we've put in place to keep our employees and our patients safe, it's really adversely impacted our throughput and our turnaround time. And so the academic medical center was already pretty full. And we knew that part of the strategy was shifting. So we think there's still lots of opportunity to do that. And we also think there's tons of opportunity to partner with others in the community to try to think about the social determinants of health and to make for a healthier community.
I totally agree. Now, I do want to remind our viewers that if they have any questions, they can put it on the Facebook Live post. We have people that are monitoring that, and then they will magically put the questions here on this iPad so I can ask them to Sue. Talk a little bit about kind of is your response to COVID-19 within APD, even though we all have like system standards and processes, has there been anything unique aside from the life care facilities, which are absolutely different? Have you had to do anything different at APD? You know, one thing I think about is you have so many buildings and so many entrances that it seems to be much more difficult to screen people as they come in the facilities. So what have been some things that you've kind of had to reinvent it for APD in preparing for COVID-19?
Yeah, I think, you know, what we've had to do is sort of simplify, because you're right, we do have lots of outbuildings and we have small numbers of people working in some of those outbuildings. And so I think what we really are trying to do, and we're continuing to try to do, is simplify the equation to make it so that folks can follow easily what we're recommending. You know, we had started on a journey of high reliability, just like everybody else has, right? And so we took this as a real opportunity to think about the principles of high reliability and apply them to our world. And so, you know, we've certainly been working on resilience. We've been deferring to expertise. We've been refusing to simplify the complex problems. Paradoxically, we've been paring down our organization and sort of saying, what are the 3 key behaviors that I need everybody to do 100% of the time? So we've narrowed down the number of doors that people come in. We've made some games of, like, you know, how do you measure 6 feet, right? Like, and so we're trying to find the prototypical 6-foot person in our organization, and that's going to become the unit of measure in our organization. You know? So instead of talking about 6 foot, we're going to talk about a person, and everybody will understand it. It's challenging, as you know, and I think the real challenge is not knowing what to do, but doing it consistently over time when people are tired. And we know people are tired. They're physically tired, they're emotionally tired. And so we've got to really think about that too. Wellness in the workforce. How do we take care of them?
Now, how many of your employees are remote working? Because we had, I think, a lot across the system. We went from very few to almost 5,000 people remote working pretty quickly. How many employees at Alice Peck Day do you think are remoting?
Yeah, I know it's not as many as you would think because we're so small. You have to get a cohort of the workforce back. I know there's like 20 folks that I know for sure are not coming in sort of consistently. Now we've got a workforce of about 500 people. But if you look at our life care organization, you know, they're cooks, they're LNAs that are providing help with activities of daily living, they're groundskeepers. These aren't jobs that are amenable to working at home. And then same thing in the hospital. It's a lot of direct, hands-on care. And a lot of the things that would be amenable to working at home, we've integrated with the system. So my IT department is
our IT.
It's the corporate, right? So those aren't my employees, and so they weren't working on our campus. Some of them are, but the majority of them weren't on my campus to begin with. Same thing with like revenue cycle. And so a lot of the back office has already been integrated and not on my campus to begin with.
And they do a pretty good job remoting. I had to actually
They do a great job.
fix my TV, and I found a guy on Verizon down the chat room that actually helped me fix it. I thought he was a god. So anyway,
That's fabulous.
It's amazing what people can do remotely.
It's amazing, and you know, to have people sort of maintain that focus and not get distracted, and I really commend the people that are doing it.
So let's really talk about the employees' resilience, because, you know, I did a little check-in with the leadership team, and I asked, like, how are they feeling in terms of level of exhaustion? And, you know, it was pretty high. People, I think the last 10 weeks have really been a roller coaster. It's hard to believe it's only 10 weeks.
I know.
But it was the first week in March that we started standing everything up. And I think people are a little fatigued. I know we have a level of our workforce that has kind of been waiting for the activity to come back, and they're raring to go, and they're excited to be back. But talk about your leaders, because they've been on point 7 days a week for the last 10 weeks.
They have been, and you know, they've done remarkably well. I am blessed at APD to have just phenomenal people working there, and they're smart and they're hardworking and dedicated to their jobs. And I worry about them because they don't get a break. I think we don't have a magic bullet for it. This is an incredibly stressful time for everybody.
Yeah.
What we try to do is, create a space where people can give feedback, where we're responsive to that feedback. One of the things we really did during all of this is we as a leadership team just completely changed how we were leading. We pre-COVID, we sort of met with our leaders once a week. Throughout this entire thing, we meet with them every day virtually, and we've gone back to once a week now. But through a lot of it, it was every single day.
When incident command would meet, and you
yeah,
make those
we would,
decisions.
and we would hear their concerns, and we would fix what we could fix, and if we couldn't fix it, we'd tell them why we couldn't fix it.
Yeah.
So we've tried to be responsive and respectful and listening. We're trying to get people to get some days off and disconnect, but and it's not going to get easier. I think that the real challenge is turning it back on.
Yeah,
right.
It's harder than people think.
It's way hard.
Now we do have some questions. The first question is about sustaining the workforce. That we were a zero unemployment state before. Has it been any more difficult through the COVID-19 period, getting the right people on your team?
Yes, I think it has continued to be challenging, and I think one of the things that's been really difficult is the schools shutting down, and now we're looking at the camps not opening, and so a lot of our workforce have young children, and to try to juggle kids and work and family in the midst of this has been enormously difficult. Yeah. So, I think that's a real challenge for all of us. And then if you think about the fact that a lot of our workforce is skilled and trained, so, where the unemployment is maybe in the restaurants and the hospitality sector and transportation, but you can't necessarily take somebody who is working in that sector and expect them to be a trained nurse on a med-surg unit or in an operating room. So there may be a skills gap that creates some challenges for us. So I think workforce is still something we're talking about every day. I can tell you we're worried about it, and we're talking about it every day.
Now, another question is about the mental impact of isolation. And you talked about that a little bit when we were talking about the life care facilities. Are there any creative ways, although I'm sure the Zoom happy hour for the Woodlands or Harvest Hill is a way to mitigate that isolation, but have there been other ways that you've been able to address that? Senior isolation and the consequences of that are pretty significant.
They're really significant.
It affects their health.
Yeah.
We know that it's something that you can't just ignore.
No, it's a real challenge, and I will say that one thing about congregate living is that they're all in the building together, so they can socialize.
Was the purpose,
right? So they're not alone in a cabin in rural New Hampshire. They're alone in a building. It's not the same as seeing your family and the grandkids. And I think the physical contact, people really miss a hug or a touch or a hand. But I think, there is contact and there's social stimulation in that regard. The other thing we've done is the administrator at Harvest Hill, the nurse administrator and the executive director, they've really figured out how to connect the residents to family with technology.
Really?
So they've figured out Facebook, and we have iPads, and they
can help them with FaceTime.
So they can help them, so that for elders who have limitations with their hands or just don't understand the technology, they're helping them to connect. And you know, I even see some folks that are, you know, sort of yelling up to the balconies and
Yeah.
sort of waving as they go by, and you know,
Yeah,
so
that's
it's really challenging,
Yeah.
but it's something that I know the folks up at Life Care who run it, they're really committed to this, and it's at the top of their conversation list.
Yeah, yeah. I know that my mom is 96 and lives in Aiken, South Carolina, and communicating during this time, she got far better at Facebook. I even did get her on a Zoom call.
Wow.
I know, with my
Yeah,
siblings
yeah.
on the day before Mother's Day. That was a pretty big accomplishment.
bet it was.
So one thing we did find out is for people that are hard of hearing, and sometimes
can be
those are
challenging.
particularly difficult, if you use the earbuds
Oh, yeah.
and turn the sound up really loud, they can
They
hear
can hear it.
everything. Yeah.
Great.
Well, I want to thank you for your leadership at Alice Peck Day. I know your team really values how you actually empower them as a team to find solutions for problems and execute on them. And really your leadership within the system. There have been some really tough decisions that we've had to make together over the last couple of years, and it's been a pleasure working with you on those.
Oh,
So.
thank you. It's been a pleasure on this end also.
Yeah. So I want to thank everybody for tuning in to our Facebook Live with Sue Mooney, who's the President and CEO of Alice Peck Day. And I want all of you to have a wonderful week.